So hello everyone. My name is Jean-Michel Fourier, and I would like to warmly welcome you to this webinar about mental health and lung conditions, which I know is a very important topic for all of us. So before I'll tell you a bit about myself, I want to tell you about the Zoom translation captions that you can use today, which are available in more than 30 languages. So to use it, you can click on the show caption icon on your Zoom toolbar. And if you cannot see it, maybe click on the more icons, and in the pop-up list, move to the translation slider, move the translation slider to the right, and then click my caption language and choose your, your preferred language. So sorry, but automatic translation, you know, is never perfect, and some words may be muddled, but we hope it will help. So if you have some problems, don't hesitate to email to the team. Mail is at europeanlung.org info, and a member to the ELF team will help you. So now I will tell you a bit about myself. I am an idiopathic pulmonary fibrosis patient. I am the president of the French Patients Organization and a member of the Patient Advisory Committee of European Lung Foundation, and also co-chairing with Jeanette the working group about mental health. And I will now hand over to Jeanette to introduce herself.
Thank you, Jean-Michel. Hello, everyone. My name is Jeanette Boyd, and I work for the European Lung Foundation in their patient involvement and engagement team, and I co-chair the mental health working group alongside Jean-Michel. So for those of you who don't know much about the European Lung Foundation, also known as ELF, here is a very brief introduction. But please do visit our website for more information. So you can see that ELF brings together patients, the public, and healthcare professionals to improve lung health across Europe. And some of the ways we do this is by giving patients a voice in shaping healthcare and policy, providing evidence-based information in multiple languages, and leading campaigns to raise awareness and improve care. But do check out the website to find out more. So now there's just some housekeeping information to make you aware of. So this event is in a webinar format. So attendees can only see the speakers and chairs. We can't see you as everyone is on mute. So we can't hear you, but you can participate in the chat, which I can see you're all doing. And there is also a separate Q&A box where you can put any questions you have for our speakers today. We know that this is a short webinar and we won't have much time to answer your questions, we are thinking, but any that you do put in the Q&A box that we don't manage to answer today, we will ask the speakers to answer after the webinar, and we'll put the answers up on the ELF website. So please keep in mind we can't answer questions about anyone's personal circumstances or case. But we'd love you to share your views, ideas, and comments throughout the webinar, so do use the chat for that as well. If you use social media, then do tweet using the hashtag mental health and the lungs, and you can tag ELF and ERS using the social media handles shown on the slide. This webinar is being recorded, and it'll be made available on the ELF website after the event so that you can freely access it, and we'll let you know by email when the recording is available. So now I'll hand back to Jean-Michel.
Thank you, Jeanette. So our audience today is made up of people with lung condition, their caregivers also, but we also welcome healthcare professionals, patient organization representative, and members of the public who have joined us to find out more about this topic. So now a little about the webinar. So the topics we will be talking about today are first, how your mental health can be affected when you have a lung condition. Then about what research has been done in this field. and where the gaps are, and the plans and activities of the ELF mental health working group, and finally, what needs to change to improve mental health for people with a lung condition and their caregivers. So many of us are dealing with health challenges on daily basis, and we hope that the information and the experiences we will share today will be helpful. But if you do find anything, I would say, emotionally challenging, then please feel able to drop out at any point if that would be helpful for you. Janet?
So now we're delighted to introduce our speakers for today, and you can see them all shown on the screen. They're each going to introduce themselves to you at the start of their talks, and we'll meet them all again at the panel discussion after the talks have taken place. So first of all, I'd like to ask Ron and Maxine Fluitt to introduce themselves and share their stories of mental health and its impact on their lives.
Good afternoon, everyone. My name is Ron Fluitt. I suffered a lung disease called idiopathic pulmonary fibrosis, and that was in 2014. I've since had a lung transplant. I'm one of the lucky few, but I would like to say it's a very important message. It's something that I learnt over the years. It's okay not to feel okay. It's okay to ask for help. You have been diagnosed with a lung condition that affects your whole life. That in itself can cause low mood. I always say to people, it's just not the patient that's suffering the lung disease, it's also the carer and the whole family. I just want to go through my personal story, which started back in 2014. I was diagnosed with idiopathic pulmonary fibrosis, which is scarring of the lungs, and I ended up on oxygen some 4 or 5 years later. I was aged 53, and I remember my consultant saying, "You've got 3 to 5 years to live." I'd met Maxine 2 to 3 years earlier, and we felt robbed at the time because obviously being diagnosed with a lung disease, we had many nights crying, etc. But the first time it really affected me, I was late for a train and I was running for a train because I still thought I was fit. And I ran for this train and I was hyperventilating. I sat on the train and I can remember bursting out in tears in front of everyone. I was incontrollably crying, and that was really the start of my journey. As the disease progressed and I got more breathless, low mood played a big part in my journey. I actually self-referred myself to a hospice after being put on oxygen, and I was on oxygen for 6 years. The hospice were very good. I self-referred myself, they accepted me. It was a way of socialising with other people with other illnesses. They offered me Tai Chi. I wasn't sleeping at the time, I was very low mood. So they offered me Tai Chi, I went to sleeping classes, and they were absolutely fantastic. And a lot of people have the misconception that a hospice is there for the people end of life. It couldn't be further from the truth. I was visited by a hospice nurse on a regular basis, and one day she came round to me and she said, "Ron, you're extremely flat. I think you need to go and see your doctor and maybe prescribe antidepressants." And I thought to myself at the time, well, I don't need antidepressants. But she said to me, if you've got a headache, you take headache tablets. If you've got tummy problems, you take medicine to, solve your medication. She said, "Ron, you're depressed. You need to, you need antidepressants." So I tried them, and within 4 or 5 months, my mood changed. I was back to the old Ron Fluitt, laughing and joking. And then COVID hit, and that became very, very lonely. And I found after COVID, people kept their distance. So my world was shrinking and shrinking. And I went into low mood again, because I remember my consultant or my LD consultant said, "Ron, you're on one hell of a roller coaster journey. You'll have your ups and you'll have your downs." I didn't know what she meant at that particular time, but I certainly did. I certainly do now. I had low mood, and went back on antidepressants, and then I was lucky enough to receive a double lung transplant. I contacted them again because I felt extremely low, and they took me on board, and it was the best thing I ever done, because psychological effect of me having a lung transplant was it played on my brain. I felt guilty. I felt lonely, and hospice were there for me again. They offered me Tai Chi, they offered me singing, they offered me support, and they've been there for me ever since. So my message is, it's okay to feel not okay, and it's okay to ask for help. I have done, and I believe it's something that got me through my lung condition and after my transplant. So yeah, that's me. I will pass over to my wife.
Good afternoon. I'm Maxine Flewitt. I'm Ron's wife, as he said, and I'm the one that's looked after him as we've travelled through this journey with his lung condition. Initially, as Ron said, you know, when he was first diagnosed, I think everybody with a diagnosis of a condition is devastated, and you feel like your world's fallen apart. The bit that I found harder, even at that point, was I was trying to keep Ron buoyed up and look at all the positives and what could be done and what, you know, what could help him. And people were rallying around him to sort of keep him going and look at all the positives. But in that time, I was thinking about what my future looked like, how things were going to pan out, what I could do to support him, and trying to keep myself buoyed up whilst I felt, if I'm totally honest, that everything was focused on Ron, and I was just the person behind the scenes that was going to be keeping my feet paddling like mad under the water, but had to keep the whole thing together. And that means the family, the home, Ron's stability, keeping him at the best he could, and trying to keep myself going. But as things moved on, we learned to come to an acceptance of what was happening with the disease, and it was a roller coaster ride. So we'd get to a new norm and we'd function well, and then something would happen, either be it medication or oxygen, or he'd have a dip in his progression, and we'd be back to square one. Now, whilst Ron was getting support with his mental health, not once was I asked how I was coping, what was happening, did I need anything, was I mentally coping with it all? So I felt very lonely and very isolated, because at the bottom of it all, whilst he was being given medication and oxygen and everything else, I was the one who was having to keep his mood lifted, having to be positive. And I will say at times that it was also that he would take it out on me. So if he had low mood and he was frustrated by what was happening, especially as he progressed through the illness, I, being the nearest and dearest, we always hurt the ones we love, were the one that was getting it taken out on. Not in a very nasty way, but obviously they get short-tempered with the medication, the oxygen makes them short-tempered, they get frustrated because I'm doing things that he can no longer do. So a feeling of worthlessness, that didn't help his mood either. I think only once in the whole time that he had the illness was I asked if I was okay, and I actually burst into tears because the enormity of it all hit me. As we went through and he got worse and worse, I would often take myself out into the garden just for my own sanity, to have a little talk to myself about, come on, rant and rave in the garden, and then come back in and smile and keep it all going again together. I think it's really important to understand that the person who is closest to the disease, other than the patient, is absolutely going through this. They are living this disease as well. Yes, the patient has disease, but their other half, their loved one, the person who's caring for them, needs that support mentally as well as physically, but mentally. It is so, so hard to watch them, to think what your future holds, and to try and keep them buoyant is incredibly hard. And following transplant, it was the hospice who asked me and told me that I needed help. I needed psychological help to get me through everything I've gone through. Not once would I say, as a consultant, I need help to get through this. So I am eternally grateful, because I really don't know where I would be now, looking back at what I've had to go through. And I wouldn't change it for the world. Ron did everything he could, but don't ever underestimate the part that a carer plays to keep the patient buoyed up. But equally, they are trying to buoy themselves up. They are trying to keep themselves positive whilst dealing with everything else that is happening. So, you know, I advocate for carers all the time. It is such a hard job, mentally taxing, mentally exhausting. And it's so easy just to sort of not know where to turn and want to ride away from it. So I hope that's helped everybody. I've tried to be as honest as I can, because I believe that that's the only way to say it. Thank you.
Thanks a lot, Ron and Maxine. It's always so inspiring, but moving to listen to you sharing your history, shoulder to shoulder. So thank you for that. And I am now inviting Dr. Lisa Brighton and Dr. Leonora Volpato for their talk.
Hi, thank you so much. And again, just a huge thank you to Ron and Maxine for sharing their experiences there. And I think nothing can bring this more to life than hearing directly from people affected by this. I guess this talk now will be a bit different, and I'll start by introducing myself, and I'll ask Eleonora to introduce herself as well. So my name is Lisa, and I am a researcher with a background in psychology based down in King's College London in the UK. And a lot of my work is focused on supporting people, particularly with advanced lung conditions. Eleonora, would you like to introduce yourself quickly?
Yeah, good afternoon, everyone. Thank you very much for this precious opportunity to be here with you today. I am a clinical psychologist and a psychotherapist, and I'm a research fellow at the Università Cattolica del Sacro Cuore of Milan. I have a long collaboration with the Heart Respiratory Rehabilitation Unit of Fondazione Don Carlo Gnocchi in Italy, but today I'm joining you from Leuven in Belgium, because I'm also working with the health group, psychology group here at the KU Leuven. So good afternoon.
Thanks so much. And could someone just say out loud if they can see my slides? That would be wonderful.
Yes, we can.
Excellent. Thanks so much. So over the next 10 minutes, we wanted to share our perspectives on this topic as professionals working in this area. So myself as a researcher and Eleonora as a clinician, in addition to being a researcher. And we're going to share some of what we currently know about the mental health challenges commonly faced by people with lung conditions and the impact this can have on living with a lung condition. We'll also talk about what we know about what can be helpful for mental health in this context, but also some of the ongoing questions and challenges faced by people with lung disease, their carers and professionals. And then finally, we'll talk a little bit about the things we can all do, hopefully, to work towards improvements in this area. So as many of you will know, and as we heard from Ron and Maxine, there's a variety of different ways that mental health can be affected by having a lung condition. And we find it can be quite useful to think of these different levels in ways that people are affected. At the bottom here, you'll see we talk about what we call psychological reactions to living with a lung condition. This might be things like feeling worried about the future or feeling sad about not being able to do something you used to do, in the same way as we might react to other difficulties that we face in our lives. Now, these can be very common and very normal, and we often learn to cope with these over time, but it's still really important to acknowledge that these experiences can be very distressing. At this next level, we talk about troublesome psychological symptoms. And these might be symptoms that maybe don't quite reach the criteria for a mental health diagnosis, but are still having a negative and maybe prolonged impact on individuals. This might be things like feeling low and losing interest in doing things, or feeling really on edge and panicked about getting breathless, or maybe feeling strong amounts of shame and self-blame about a health problem. And then at the top level here, we have the more severe and prolonged symptoms, which might then meet the diagnostic criteria for a mental health condition, like having a diagnosis of anxiety or depression. Now, in all of these cases, we want to be thinking about how can we provide support that meets this person's needs. We also hope that if we can help people earlier on with these problems we see down the bottom, that maybe fewer people might go on to experience the more severe challenges at that top level. And the other really important thing to note is, while this picture here was created thinking particularly about people living with lung conditions, of course, we could hear from Ron and Maxine's story about how a lot of this will also be experienced by a close family member or carer as well. Now, as a researcher, I am often looking at how this translates into numbers. And for me, the number suggests three really key and important points here. The first here is that if you're experiencing these challenges, you are not alone. Around 1 in 4 people with lung conditions are affected by things like anxiety or depression. We also know from research that people with lung conditions are around 2 to 3 times more likely to face trouble with their mental health compared to someone who doesn't have a lung condition. And we also know that mental health problems can make it harder to take care of yourself. For example, making it harder to take part in physical activity or take your medications as planned. And this is why we're really keen to develop more and better support for mental health for people with lung conditions, as it's such a crucial part of people's overall health. And if we ignore this part of people's health, we're not helping people as best as possible. Now, the good news is we already know from research studies that there are several services that can be really helpful for mental health in people with lung conditions. For example, we know that taking part in pulmonary rehabilitation, so services that tend to combine a mixture of supervised exercise sessions and education to support self-management, can be really helpful for mental health as well as helping physical health. We also know that interventions called supported self-management, so services that help people with lung conditions to have the skills and confidence to manage their condition and manage their symptoms, can also be really great for mental health. And then, of course, for some people, psychological therapies like cognitive behavioral therapy, for example, can be really useful in managing distress and improving mental health. And there are many other ways that psychological approaches can potentially be helpful in the context of living with a lung condition, even if it's not helping mental health directly. For example, we also know that there are particular psychologically informed techniques that can help people to stay motivated and take part in those important health behaviours, like taking part in physical activity, which we all find challenging at times. However, there's still a lot we don't know about how we can best support mental health in the context of a lung condition. And as a researcher, these are the things that we really want to push for more studies about. For example, we've got some strategies that seem to help some people, but they don't always work for everyone. So we need to understand a bit more about what works best and for who. We also don't know when's actually the best time to integrate psychological support for people, and how's the best way we should deliver this. So alongside this, we also probably don't have a great understanding from research. How do we best include and support carers within this process? And research in all of these areas is really needed if we're going to overcome some of the challenges that we see in current practice. And that's what I'm going to hand over to Eleonora to talk to you about now.
So, as we have seen, clinical practice and research alike reveal significant barriers that stop us from fully addressing psychological distress and mental health. And today I'll walk you through these key challenges, from patient and family issues to clinical and research gaps, and explain why they are important. Let's begin with the patient perspective. Patients with lung disease and their caregivers are rarely involved in designing the very intervention meant to help them, and this means that solutions often don't match real-world needs. Another challenge is communication. Patients face barriers like lack of understanding about anxiety or depression, or reluctance to share their struggles for fear of judgment or stigma. And there are also sometimes complaints that reflect frustration with side effects or complex treatment plans or feeling unheard. And over time, all these frustrations can lead to disengagement from care. So it's essential to recognize these issues and work closely with healthcare providers to develop practical and patient-centered solutions. Then the caregiver-patient dynamics sometimes are challenging too. Patients sometimes feel like a burden, making it hard to accept help or to ask for help. And meanwhile, caregivers may experience their own stress, exhaustion, and even confusion about the emotional impact of lung disease. So balancing support and independence is a challenge for everyone involved. And lastly, navigating the healthcare system can be overwhelming. Patients often aren't sure who to call, and this uncertainty can delay getting the right help at the right time. So we can move forward with the next slide. Thanks. On the clinical side, we face our own obstacles. Mental health care is inconsistently integrated into respiratory care. On one hand, we know that clinicians face short communication and consultation times, limited training or lack of standardized diagnostic tools. And on the other, there are some systemic issues too. For instance, poor communication between primary care and mental health services or scarce resources that exacerbate these challenges. So this cycle of unmet needs calls for integrating treatment approach that involve not just clinicians, but also patients, caregivers, and better resource allocation. And in the research realm, as Lisa said, we face major hurdles. There is often this blurred line between general psychological distress and anxiety or depression. We need well-designed clinical trials that not only assess the effectiveness of a trial and of an intervention, but also the long-term impact of these treatments, and that consider factors like cost effectiveness or healthcare utilization. And now, a few tips. For patients, please remember that caring for your mind is just as important as caring for your lungs. Recognize early signs of stress, anxiety, or depression, and stay active, connected. Even a short walk or a friendly chat can boost your mood. So use relaxation techniques, maintain an healthy routine, and don't hesitate to ask for help when you need it. And finally, talk openly with your healthcare provider about your mental health in order to explore all the possible ways and coping strategies that work best for you. And if you are caregivers, your role is critical but crucial. Sometimes we know that the most powerful support you can offer is simply listening. So allow your loved one to share their feelings and emotions without immediately trying to solve every problem. Remember that's normal to feel stressed or overwhelmed, and make sure you also care for your own health. Take breaks, seek support from peers or professionals, and remember that taking care of yourself is essential for providing the best care to your loved one. So what should we do? We must take a multi-level approach, raising awareness, sharing what works, training health professionals in mental health care, investing in research for new interventions and trials. And importantly, success depends on partnership, because only together we can create a system that supports both the lungs and the mind. And if some mental health professionals are connected, please join me and Lisa at the group 0904 at the ERS. So let's work together to ensure that lung health always includes mental health. Thank you.
Thank you, Lisa and Eleonora, for highlighting some of the approaches and things that can help, as well as the challenges and research gaps that we all need to work together to address. Thank you so much. And now I'd like to invite Jean-Michel Fourier, who is going to tell us more about the Mental Health Working Group and its activities.
Thank you. Thank you, Jeanette. So where does this idea to create a working group about mental health and lung diseases come from? Mental health, in fact, and lung disease was a topic discussed during the ELF Patient Organization Networking Day in September 2023 in Milano. And during the morning, we had contributors that made it clear that this subject is a priority for the impact on both quality of life of patients and their families, but also to the survival of patients. And during the afternoon, we ran some working groups who not only confirmed that point, but also showed that patients' associations are present on the subject to try with their limited resources to help patients and their family. But this is also often because there is nothing coming from the healthcare system. So the main output of the day for us was that mental health is part of the healthcare and should be included in the standard of care and not considered as very often today as a bonus for patients. So it's not acceptable, in fact, that patients' organizations should currently assume almost total responsibility for these actions, but both in terms of providing them, but also about their cost. That means limited access to patients and caregivers. So when I returned back home, I was very happy, in fact, to have been able to exchange and on this subject. But I also said to myself, okay, guy, everyone agrees about that. We know what what needs to be done. But so why is there nothing moving and changing? So why is there nothing happening we need to get beyond this status quo and get things moving. So why a call to action and a call for change? Because like many quality of life issues, I think if we don't shake up a bit the authorities, it's a subject that will never be addressed because it is considered by a non-priority subject. So we really need to succeed to add a sense of urgency and but also with evidences. So we call for volunteers to from the ELF network of patients organization, and we got our first meeting on April 24 with representatives of from various conditions, lung conditions, and also from various countries. So we set ourselves 4 objectives. The first one is to really evaluate the way mental health is assumed today in our healthcare system for various conditions, and if possible, initiate support. Second point is to evaluate the current research status, initiate support, and launch when needed some new studies about it. Third objective, to empower patient organization by providing them information, education, and any other kind of help. And finally, advocate and promote this integrated care. So what have we done? In 2024, we compared first how a healthcare system take today into account this topic, and we admit that it is not very good. The second point was we also discussed the role of patient organizations, which are doing their best to meet these unmet needs. We were also taking a look for examples of good practices and try to to try to draw up a kind of solutions kit, maybe for association. And at this point, it became clear to us that we needed to build links with mental health professionals in order to benefit their expertise and to learn about the status of knowledge and evidences and research in this field. So we contacted the ERS group 0904, and that was launched in 2020 to support this psychological aspects of respiratory care in order to improve multidisciplinary clinical practices and education and research. And we also learned a lot about what could be done to get national and European health policies moving. In order to conclude, and what next? What will we do now in 2025? What is our action plan? What are our ideas? So if I try to summarize, the first one will be very soon to run a survey to gather more detailed information and experience to both sides, patients, carers, and also healthcare professionals to support with maybe to support with writing a paper on what needs to be changed. Second point will be to gather good practice from patients' organization, again to build a toolkit that can be used by all patients' organizations all around Europe. Third point, to run a systematic literature review with our clinicians' support to identify evidences about mental health services for people with lung condition, and this could apply also for an ERS statement. And maybe a new idea that jump up to develop a kind of emergency kit. It is something that is existing for physical injuries, and why not trying to do the same for people? They could use it when they feel anxious or stressed. So here we are with a group of deeply convinced and committed people, and I would like really to sincerely thank all of them, and thank you all for your attention, and I hand over to Jeanette.
Thank you, Jean-Michel, for updating us on the progress of the working group, and we really hope that everyone today will support our activities going forward. So now, for the final part of our webinar, we're going to invite all the speakers to join us with their cameras on so we can have a discussion about some really important questions and points that have come out from today. And if anyone does have any specific questions for the speakers, do put them in the Q&A box and we'll try and find time to answer them today or after the event. So are we all here? Yes, lovely. So I think our first question is really, one of the things was how much do you feel that mental health is linked to other symptoms that people with lung conditions experience? So things perhaps breathlessness or fatigue. So Ron, I really wanted to ask you first, do you have any experience of your lung symptoms affecting your mental health? And can you tell us more about this, if so?
That's a good question. Yeah. I think refer back to diagnosis and my ILD nurse saying it's a roller coaster of a ride. I've suffered lots of low mood. I look at myself before diagnosis. I had a very good job. I never suffered low mood in my life. I was a salesman. I was out and about, so I had a really good life. But when you're diagnosed with a lung condition, that includes any lung condition, and your breathlessness and the cough. The breathlessness to me was the most awful thing that I've experienced in my entire life. It's like breathing through a straw all the time. And it was like, I've got to think, it was like as a disease progressed, your world gets smaller and smaller. I don't know if this answers the question or not, but it gets smaller. Your friends distance themselves from you because they ask you to go out and you can't go out. And then in the end, you can't go for a walk because you've got your oxygen, you've got to plan everything. So low mood is in my mind, plays a big part in a lung condition and when you're diagnosed.
I'd just say that he did have panic attacks as well because of the breathlessness. And then that impacts on the mental health, because then you don't want to go out because you are anxious about having the panic attacks. So then, of course, that puts more pressure on the whole situation. So definitely the symptoms, the fatigue, definitely.
Fatigue was awful.
When he was tired all the time, he was just so frustrated and angry and like annoyed that this was stopping him doing things, and that affected his mental state of mind, definitely, because it made him really, what's the point? I'm so low. Whereas if he could get out and about, he'd feel better.
Yeah. And bearing in mind, I was a triathlete. I belong to swimming clubs. I belong to lots of sporting clubs. So for me to get a disease that makes you breathless was absolutely devastating for me.
Thank you both. That's really useful to hear. And Lisa, I'm wondering, is there any research in this area that you could tell us about?
Yeah, so I mean, your experiences really chime with what we see in research studies as well. So we know that people who are kind of more impacted by their symptoms, and particularly people impacted by breathlessness, are some of the people that are more likely to then face trouble with their mental health. And actually that's reflected in some of the kind of guidance documents we see around managing lung conditions, and clinicians are particularly encouraged to look out for those people who are maybe particularly more limited by their breathlessness, as those are the ones that we know can have particular trouble in this area. And I guess the other thing that we tend to see is that these relationships can go both ways. And I think you illustrated that really well, Ron and Maxine, with how you describe those experiences. So, for example, we sometimes see that people might be getting a bit anxious about being breathless, and therefore they avoid activities that they don't want to get breathless from. But then avoiding activities can lead to more kind of deconditioning of the muscles, which can lead to more breathlessness. And you can end up with these cycles. And while it can sort of feel a bit scary that you can get these kind of vicious cycles going on, I guess the flip side and the opportunity for that is it shows how interlinked the physical health and mental health are, and that we've got more than one opportunity to help people, because if we help people manage their symptoms, that can help with mental health. And if we help people manage their mental health, that might also help manage their symptoms. So I think that's the really important link we often see in the research studies.
Thank you, Lisa. And we know, and we've heard today, that mental health problems are really common. And one of the barriers is around stigma. We heard that from the clinician's presentation, or a negative attitude around mental health, and that this can make many people's problems worse. So Jean-Michel, is there anything you'd like to say about the role of stigma in mental health?
Yes, Jeanette, I think the first barrier often comes from the patient or the caregiver himself. In fact, the work of a psychologist or a psychotherapist is not well known until you have had to experience it. And in my own personal case, I didn't see the value of it. In fact, I am telling myself, I am a lung patient. I am not crazy. I don't need a psychologist. And I must admit that it took me just 20 minutes of talking with a psychotherapist to discover how good it was for me, how much benefit I can have with that. And now I don't know how I have managed to without it for so long, in fact. And this is why I think it's so important to communicate, to explain, and to share our experiences as patients with other patients, in fact.
And Ron and Maxine, have you experienced any stigma around talking about your mental health, or anything that you could share?
Yeah, I mean, I'll go first. I don't think that it's ever thought about when I've been at any clinical appointments with Ron, or even at the doctors for myself for different things. It's never been thought about how it may be affecting my mental health, watching my loved one going through, quite a severe illness, and having to cope with it on a day-to-day 24/7 basis. So I think the stigma has been that people don't want to ask you because they don't want the answer, because they don't know how to help you. And that's my biggest feeling, is if we don't ask, we don't have to deal with it because we don't know how to deal with it or where to signpost you to. If there was something that they had as a kit that they could say, well, okay, we can signpost you here, I think you would be asked more.
Yeah. And I think from my personal point of view, I used to hide my breathlessness because I was ashamed. So if we'd gone out with friends and we walked up a slight hill, I would walk away from them to get my breath back. And I remember my friend saying after, he said, you hid your breathlessness so well. He said, I just thought you was on oxygen. He didn't realise how breathless I was, because the stigma behind that was I'm going to use the word awful. I was embarrassed. Just by walking up a slight hill, I was like hyperventilating. So yeah, so there's a lot of stigma behind that as well.
Thank you. And I think leading on from that and what you touched on, Maxine, you know, how do patients and healthcare professionals talk about mental health issues together? You know, it is a difficult thing to do. And Eleonora, I'm wondering, as a mental health practitioner, how do you think healthcare professionals deal with conversations about mental health with their patients, particularly perhaps if they don't have expertise in that area? Do you have any advice for them?
Yeah. So as we have seen during the presentation, many healthcare professionals, especially those in the respiratory field, unfortunately, sometimes recognize the importance of mental health, but they don't have enough time during visits to dedicate the proper attention to this topic. Or sometimes they just feel uncertain about what to answer, how to address them, due to a lack of formal training. And so the conversations about mental health sometimes are really very brief or just focus primarily on physical symptoms. But I think that's important to integrate into a routine also the mental health part. And this doesn't necessarily require being a mental health specialist. I mean, small but meaningful steps, brief questions like, do you ever feel anxious or low because of your breathing symptoms or difficulties? Can help patients feel heard, encourage them to open up, and even acknowledging the emotional burden of lung disease, validating the feelings of a patient can be really, really important and powerful. So if clinicians can have the time just to ask these brief questions, maybe they can open the way to other solutions for these patients, such as, you know, self-help strategies, the possibility to enter to a pulmonary rehabilitation program that include also psychological components or support groups.
Thank you, Eleonora. There's a question in the Q&A asking this very question: how can healthcare systems better integrate mental health care into respiratory treatment plans? And I think I'd like to ask all of you really, is there one area that you feel is important for how healthcare can better support mental health for people with lung conditions? So is there one thing that you'd like to see changed in healthcare settings that you think would really help to improve things? It's a big question. Would one of you like to offer something up?
That is a really good question. I'm thinking back to when I was very low with IPF and I'd gone to the doctors. He didn't understand the disease. So when I went to him, he would ask what I wanted and what I needed, because he didn't understand. So I would like GPs. There's simple things that they can do. If someone goes with breathlessness or a cough, they can obviously use a stethoscope, go to the base of the lungs. If they hear the crackles, then they know it's some kind of pulmonary fibrosis. So, you know, they need to be educated more.
I think I would say is when you're in an appointment with whoever, consultant, nurses, specialists, doctors, is when they say to you, are you okay? And you just say, yes, I'm fine, is to ask that question again, because we all say, yes, we're fine. But if you ask again, you're more likely to get the truth out of how you're feeling. And I know that's especially true to Ron. He's like it all the time. If you ask him once, he's fine. If they ask him again, they'll get the answer. And then maybe they can signpost him to where he can go to get help for the panic attacks that he had, for the breathlessness that he was feeling and how to manage it and what he can do. But nobody likes to put any pressure on the doctors in the consulting rooms, because we know that time is precious for them. So we all like to say, yeah, we're fine. But they need to just ask twice, because then I think you get more of an answer.
Thank you. That's a really helpful piece of advice, I think. Lisa, is there one thing that you'd like to see changed in the healthcare setting around this?
I think for me, there's something about giving mental health a greater kind of status in respiratory care overall. And I think so many practitioners do feel it's important, and many to feel like they're able to broach those topics. And I guess one of the other limiting factors, I think, for a lot of services is having the options available to them to provide that specialist support where needed. And it's very hit and miss at the moment. So I think for me, there's something about kind of almost like equity of access to the right sorts of services to support mental health in respiratory, because I know that there are in some places really excellent practice, and in some places the services are just simply not available. So kind of making sure that we're evening the playing field a bit, having equal access to those specialist services where they're needed, and making sure that mental health is staying on the agenda as a core part of respiratory care in the same ways we sometimes see in other conditions more so. So the example I often think of is in cancer care. Psychological health has a much higher profile, and we see people working in, there's an entire field called psycho-oncology about the integration between psychology and cancer care. And I'd love to see something like that about respiratory psychology and making sure we're seeing that integration more consistently.
Great, thank you. And I can see some really great comments coming up in the chat as well from people, and we'll take all of these on board and collect them afterwards as well. Jean-Michel, is there anything that you would really like to see changed?
I will not add something. I think Ron and Maxine described very well what, from a patient point of view, what is that having a lung condition is not only having a lung condition. It's a lot of things we have to deal with, so I will not add about that.
That's fine. Perhaps I can go on to something else that you might like to comment on. So we know that patient organisations and patient support networks give lots of support to people struggling with their mental health. Do you think there are ways that their expertise and experience could be used better? Jean-Michel, do you have a view? Yeah,
I think if I have to push something, I will talk about support groups, and for me, these groups are really valuable, and for the mental well-being of the patients and carers, they provide a very safe and comfortable space where individuals can share their experiences, their emotions, and all the challenges they have to understand and to deal with. So this is, I think this is especially beneficial for patients dealing with serious and rare conditions, illnesses, because it allows them to feel heard, to feel supported, and less isolated in their journey. And these groups very often facilitate learning also about learning new daily life strategies. We discussed a bit with Lisa and Eleonora before. So for me, this is something we really need to push as a good practice.
Thank you. And Ron and Maxine, I think you've had experience of support networks, and I'm just wondering if you feel they could be used better within the system.
Yeah, I do work on a support line for a patient organisation, and obviously you've got family members, patients and carers ringing up, and I think the importance of that is that it's trusted information that they're getting from people who understand the disease and have normally either lived it or they're a nurse that's dealt with it. And the other thing is that it means that we can signpost them to the services that we know of, and we know they're tried and trusted services. So wherever they are, we can signpost them to the correct areas that they could go to, which aren't always given to them at the hospital. So it enables them to feel that there's somewhere they can speak to people that have that information to hand for whatever question they've got that they can ask. So, you know, to me, I think the patient organisations can play a massive role in supporting them with signposting as well as all the other areas they cover.
And from my point of view, I used to chair a support group at Papworth, and I love talking to other people, you know, if they was on oxygen, whether medication they was on, we'd swap little ideas, notes, like one, but I used to use a deodorant spray, and one guy came up to me and was talking about it. He said, "You got a lung condition, why are you using a spray?" He said, "Use a roll-on." And it's little tips like that that you get from other patients, you know, and I found it very reassuring, supportive. Yeah, it's brilliant. So if anyone's got a lung disease, find a local support group.
Thank you, that's great. And I think just very quickly, if we've heard a lot about the research gaps, and what research do you think should be prioritized, focusing on mental health in lung conditions going forward? Perhaps Eleonora or Lisa could kick off with that.
If you want. So from my side, I think that it would be great if we have the opportunity to co-developing something with the patients and caregivers. I mean, co-developing, for instance, patient education materials or courses and self-management programs, so with the organization, because that can be a very good point to develop also new psychological support that are more tailored on what a patient or a caregiver or both needs during their path with lung conditions. So I think that's the main thing that I can think to, you know, just have a strong partnership. Something that can be valued, I think, all over the world, because I know that there are a lot of problems that sometimes are different from country to country, but some problems are the same, especially those about the resources. So maybe we can work together to improve this.
Great, thank you. I can see we're coming to the end of our time. We could talk for probably another hour, I think, on this huge area, but thank you all so much for answering those questions. I think we've got some closing comments, and thank you for putting everything that you have done already in the chat. So if you want to find out some more information about mental well-being and lung health, on the ELF website, we have some information. It includes things about how to look after your mental well-being, where to find support, treatments, and some links to other organisations and resources. So do go there. And a final thank you to all our speakers, the technical team. We are sending a feedback form out to everybody. And there's a chance there for you to leave us your email if you want to be kept in touch. You can see information about the European Lung Foundation and also the European Respiratory Society group if there are healthcare professionals who are members of ERS or want to be and want to get involved. That's another way. So I'm just going to pass on to Jean-Michel for some final closing words.
Thank you, Jeanette. Dear friends, dear ladies and gentlemen, as we come to the end of this moving and insightful webinar, I want to take a quick moment to express my gratitude to each one of you. Seeing so many participants come together around this crucial topic is really inspiring and comforting. And we discussed a lot that living with a chronic respiratory disease or supporting a loved one through it is an immense burden. It's a daily challenge that affects not only our bodies, but also our minds, our emotions. So when our mental well-being suffers, our ability to cope with illness, to follow treatments, to maintain hope suffers too. So this is why it is essential that we, all together as patients, as caregivers, receive the support we need. And no one should have to carry this weight alone. And psychological care, must be fully integrated now with the standard of care, and our voices must be heard. Today, I feel more convinced than ever that we are not alone. Together, patients, caregivers, healthcare professionals, and researchers, we have this power to make change happen. So let's continue. Let's keep talking. Let's keep sharing and fighting for a more compassionate and holistic approach to care, because I am sure that together we can make the difference. So if you have some comments, some ideas, please don't hesitate to share it with us. And again, thank you all for being here today with us, for your engagement and for your commitment. And let's keep moving together. Thank you.